Welcome back to Daytime. Now, diabetes is known as a silent killer because many people only become aware that they have the disease when they develop other complications. And here to tell us a lot more about diabetes is podiatrist Mark Bradley. Thank you so much, Mark. It's always a pleasure having you here.
Really nice to be back again.
All right, let's talk about diabetes. We'll get into more of the specifics later on, but right now, diabetes, how prevalent is it in the Peel region?
Well, there's just actually a recent study published. Unfortunately, it takes a while to get the numbers out, but it dates back basically covering the period from 1999 to 2009. And they basically figured about 8% of the population is affected by diabetes at the moment. And there's a further 10% that don't know they have it.
Really?
So yeah, it's very, very prevalent.
That's almost 1/5 of the population.
A lot.
Wow.
Yeah.
And there's two types of diabetes, right? So that not everybody has the same thing.
Correct.
Can you break down those?
Predominantly, we get type 1 diabetes, and that normally affects younger people. It's not an immune disease where your body basically attacks its own system and prevents you from producing insulin. As a result, typically, those individuals have to be administering insulin to themselves to manage their diabetes on a daily basis. The second and more prevalent population are those with type 2 diabetes. Traditionally, that was something that we developed later in life. As we get older, we didn't produce enough insulin to match our diet, and suddenly we developed these little spikes of blood sugar. And typically, again, that was controlled usually with oral hypoglycemic agents and diet control.
Okay, so what are the possible effects of poorly controlled diabetes?
Well, the biggest thing is very few people actually, die as a result of just diabetes. Occasionally, there are situations where you can have a hypo or a hyperglycemic event where just your blood sugar level is so high that it can have catastrophic effects. Normally what happens is you run along with these elevated sugar levels and it affects our kidneys. We can have renal failure. It can result in damage to your vision. It can result in peripheral vascular disease. So there's a host of other side effects, neuropathy, where we lose our sensation. So it affects basically every system in the body. So what happens very often is the diabetes piggybacks other conditions and exacerbates and basically makes them worse.
So can you be susceptible to one type over the other? I mean, obviously there are a variety of factors.
There are a lot of factors. There's a degree of inheritance, especially with the type 1 diabetes. You're certainly more likely to be at risk from type 1 diabetes, for example, if you had a parent or a family history. There's a familial history as well with type 2 diabetes. There are other factors, for example, genetic or cultural backgrounds. Certain cultural groups are more predisposed to it. Then there's the sort of more manageable factors, for example, obesity. We're running at the moment, apparently 25% of the population are classifiable as being overweight or obese. And that's a huge factor in precipitating type 2 diabetes. So there's a host of things that basically can make you more likely to suffer from this.
So what can a person living with diabetes actually do to control their condition?
Well, the most important thing is they've got to, first of all, be diagnosed, and too many people, unfortunately, are not. As we suggested earlier, there's a further 10% that aren't diagnosed. So that's the number one thing. We all should, on a regular basis, go and see our family physician and get checked out. Your annual checkup is there for a real purpose, and it's very important, and it's amazing the number of people that don't do it. Second thing is, once we know that we are an actual diabetic, the main management, or the main control of diabetes, be it type 1 or type 2, is your diet. And you need to see a dietitian. Even if you saw a dietitian last year, the year before, or 5 years ago, knowledge changes all the time. Our foods change all the time, so the knowledge base on the nutrients and what food is bringing to you changes all the time. So you need to really spend a lot of time with a dietitian and be honest, be truthful, and reveal what you're eating. The next thing, obviously, is education. The more these patients understand about their diabetes, the more they'll be empowered to actually be able to look after themselves. And the biggest factor we typically find in conversation, because we deal with diabetes a lot, as we'll talk about later, it's a family disease. because it affects your diet, the entire family has to be involved in this. And that can be looked at positively or negatively. A lot of the times our patients will look at it and go, this is a really negative thing in my life. I wish I didn't have the disease. What we try to put on them is a different perspective that it's actually a bonus for the family, because too often we don't think about what we're eating and the impact of what that has on our bodies. So for the whole family to embrace that individual with diabetes, change their habits, change their eating habits.
It's almost preventative for everybody else in the family as well.
And not just for diabetes. Obviously, cardiovascular disease, there are so many things that are affected by our diet, and especially obesity, that the more we can all be part of it, and obviously it's a very good and human thing to to embrace our family health.
And that's a key thing as well. You touched on how important it is to control it once you do understand that you do have it. What are some other things, though, that families or individuals can do to help control their diabetes once they've been diagnosed?
Again, some of our patients are quite elderly and don't have the flexibility to get down and check the periphery of their body. So having a little help there. And a lot of our older patients are not living in family situations anymore. So where you're visiting an elderly relative who has diabetes, to be able to help them out as an accessory to the current environment they live in, to help take care of them. It could be something as simple as just putting cream on their feet on a regular basis and having a look and reassuring them that everything's okay. In more dramatic situations, it can be changing dressings on wounds and assisting them, or just urging them to actually seek help. A lot of the times, some of the very simple things we get, individuals have been living alone for a very long time and just neglecting themselves.
Right.
And then they get embarrassed because they don't want anybody to know what's happened down, in our case, in the feet.
Exactly,
Sure.
and that's what we'll be talking about actually in the next segment, because like you said, diabetes can really lead to other complications that can be very detrimental.
Very much so.
Okay.
Yeah, so we'll talk about that when we come back, if you'll hang around here and
Absolutely.
educate us and inform us, as you always do. So definitely stick around. If you know somebody in your family, or if you yourself are suffering from diabetes, you're definitely going to want to take some notes in the next segment coming
Absolutely.
up, talking all about how it affects your feet and your lower limbs.
Nice to be back.
Now let's talk about how you actually help these people who, in our region, who do have diabetes and are struggling to cope and get through their diagnosis. What are some of the things that you do on a regular basis to help them?
Okay, well, first of all, as we spoke earlier, we reinforce what the rest of the health community is trying to do. We're being involved with them, encouraging them to see their dietitian, involve their family, see their physician. The biggest thing is obviously testing, make sure they're testing their blood and what sort of results they're getting, making sure their management's good. Because with good dietary control, it's amazing the number of patients who can actually get off medication altogether.
Really?
Yeah, absolutely. And more it seems to be, we get the extremes at one end. The more people understand, the better they're able to manage it, and they can actually go medication free. And then there's the other side who basically, unfortunately, just give in to the depressive state that sometimes accompanies this, and they just get worse and worse. So it's the gap in the middle is getting greater. On a more practical thing, as a podiatrist or chiropodist, our main focus is the lower limb. And the further we get away from the central core of the body, the effects of a lot of these systemic illnesses become greater. And primarily with diabetes, the biggest thing is how it affects the circulatory system. And in affecting the circulation, it also affects the peripheral nerves. So those little tiny nerves that are dependent on these tiny little blood vessels bringing blood to them, they lose their blood supply, and as a result, they lose sensation, which puts them at risk for damage.
And you've actually brought some tools with you as well that you use on a daily basis.
I wanted to show what severely complicated tools we use to assess this situation. And
Sensing the sarcasm in your voice.
yeah, and it is this simple.
Okay.
And literally, this is a little filament, like a piece of fishing line. And by testing, we can actually test whether the patients can feel that. And that light touch is one of the first sensations to go.
Can you do that again
Really?
so that people can see that you're not sticking that through your hand?
Yeah.
It's bending.
It's literally, just so long as it bends like that, but it's amazing that, that can diagnose a condition long before it actually appears.
Wow.
So when we see things like that sensation, that level of sensation disappearing, it can stimulate a discussion about, when was the last time you had your blood sugar checked? When have you seen your physician? The other thing is vibration. We place this on a bony prominence. And again, vibrations were very, very early sign that there's something amiss with the sensory ability. The other thing, and obviously, as I mentioned earlier, circulation is a big factor. This is a little portable Doppler unit. From this, we can test whether, first of all, there is actually circulation present, and we can actually listen to the quality of the blood vessel and tell whether there's arteriosclerosis, which is basically hardening the artery and a reduction in the diameter. So we can do an amazing amount of things with just something as simple as this.
Okay. So let's get to the lower limbs here. How does diabetes actually affect our lower limbs?
Well, once the circulation's diminished, obviously the tissue's at risk from breaking down. And when there's damage, trauma to the tissue, it can take longer to heal because of the elevated blood sugar. It creates a wonderful environment for bacterial infections, and it's really hard to treat them. Again, if the circulation's poor, it's hard to get antibiotics down there to actually treat the infection. So it can be a very nasty situation. So,
and we actually have a chart to exemplify that right here.
Yeah, and again, you can see from the level of the ankle down, that's where the arteriosclerosis has its greatest effect. So typically we'll check and evaluate around the ankle and see what the blood vessels are like there. And very often what we'll do is have the patient lie flat and compare the circulation in the arm to the leg, and basically there's an index that'll indicate to us how healthy they are.
And you'll notice that purplishness that we saw in that picture?
Well, that
I mean, obviously not quite to that extent. It's a little bit,
jokingly, unfortunately, yes, you will notice the difference. Literally, the first thing you'll notice is hair growth is absent. The skin's very shiny, and you can tell the quality of it is very, very papery, and it's very easily damaged.
Sure.
Okay, so let's take a look at the next.
And I think this is an
Chair.
X-ray, so it affects the bones as well, correct?
Sometimes we'll request an X-ray looking at a structural issue, and very often we'll pop the X-ray up, and you can see there at the front of the ankle that sort of very white structure there pointed out by the arrows. That's actually the main dorsalis pedis artery bringing supply to the top of the foot. And the white's actually calcification. That shouldn't be there.
Oh.
So that blood vessel is quite hard, quite inflexible, and presumably reduced in diameter quite dramatically.
Ooh.
Again, as we go further down, you can see in between the two bones, the big one there, the big metatarsal, and the next door neighbor, there's like a little worm running up in between.
Yeah,
That
what
again
is
is the blood supply to the big toe. So that patient's quite compromised. So very often this is the very sort of first thing we will see, and the patient has no history of diabetes, and we'll encourage them to go very, very quickly and get a fasting blood sugar test done.
Now, not to go too negative here, but I mean, if these things go untreated, what's the worst case scenario that we can expect?
Again, the most common thing, unfortunately, is the breakdown in the tissue and ulceration. If the infection's bad enough, it can result in amputation, and that is our biggest goal, is to avoid that.
Okay.
You know, our diabetic patients are 20 times more likely to suffer an amputation of the lower limb, non-traumatic, than the normal population. Once you've had one amputation,
That's an
kinda goes
example
on.
right there.
So that's a very good example of what happens when the circulation completely gets compromised. Sorry, these are the actual least frightening photographs I could find in my very large
So
collection.
this is a milder case than what
Yeah.
you can actually
So
expect.
this, on the other hand, there's a diminished blood supply, but the sheer amount of pressure underneath that second metatarsal has caused the tissue to break down. Again, because the patient keeps walking, the pressure keeps being present, it's very hard to get that to close. So we have to work very, very hard. Again, this is a really good example of a little combination of both. The toe is curling, so there's a lot of abnormal pressure on the tip of the toe. The circulation's not great in the tip of the toe, and as a result, we end up with a little wound like that. And it can be life-threatening. Once it gets into the bone, you know, the patient is on antibiotics for anything up to a month trying to treat that that bony infection.
Okay, well, this is, like we said, a milder case, so it can get much more worse. But before it gets to that stage, can you eliminate all of these?
Absolutely.
Yes, you can.
If we can assess that there's a problem in circulation, then the next thing is, in combination with the rest of the healthcare team, we can get them off to see a vascular surgeon, see if we can improve blood supply, we can make sure their medications are controlled. If there is a pressure point, we can identify where it is, what's causing that pressure point, and alleviate it. And sometimes it can be something as simple as just reducing calluses down on a regular basis in the bottom of that foot that had broken down. Just reducing that can be enough to prevent them from ending up in a catastrophic
Mark,
situation.
Thank you so much for coming once again and sharing all this information with us. It's been a real pleasure. You know, it sounds like it starts with a good diet.
Yeah.
So make sure you control that diet because you can prevent all of this from happening.